But the funny thing is that I got an email last week that I had gotten my black belt back 26 years ago. And I had been back in the studio in over 20 years. And they had a black belt reunion. And on Saturday, it was a 5-hour seminar. Well, I figured, okay, I go to the seminar, you know, and check out the new things. Karate don't do a seminar sitting there and listen. They work out for 5 hours. So guess who's humbling around today? It's been a long time. So, you know, I'm blessed by everything on here. I'm blessed by everybody in the group. And it's just that I appreciate all the leads and everything that comes from, you know, not just business partner, but I consider you friends. I consider the personal situation. Now, what do we do as far as like what's going on with healthcare reform? The House just voted in their version of the changes that are going to come in. And so, yes, some of the things that they included, yes, you can still keep the insurance on the kids till 26. The policies will still be guaranteed issue, but it's subject by the state, where unhealthy people can be, they can charge whatever they want. And pre-existing conditions, they can put a 30% surcharge on if they want. But whatever the House is, there's a whole list that's gone there. I've read every bit of it too. And whatever the House has come up with, 90% of it won't be there by the time it gets to the end if it does, because now it's in the Senate. Yeah. Now the Senate's going to come up with their own plan. And whatever they come up with, the Senate and the House have to work it out together, and then the President gets to sign it. So there's a lot more to come. And I'm basically right now, when somebody calls for insurance on individual health insurance under age 65, you cannot get a policy under the current law right now until open enrollment, which is going to be November 1st to December 15th this next year. That's 45 days, and that's it. And I don't think that the current administration is going to extend this like it did in the past. Now, how else can you get a policy? Well, you've got to have a qualifying event. What's a qualifying event? You lose a job. You move from one state to another. You lose a job and you lose your group insurance. So there has to be a divorce situation. But what you want is you want an agent with you that works on your behalf. Here's an example. I had a young gal that really couldn't afford much for the insurance, but she was pregnant. And it was the time was that we did the policy in November. So what I did is I put her husband and her other children on a very high deductible plan to save money, but I put her on a very enhanced plan. She delivers the baby in February, only has $800 out of pocket on a total delivery, but under the current law, that's a qualifying event. I put her on a higher deductible after she delivered the baby. They allowed us to do. So I work on your behalf. On Medicare, over age 65. And I think this is important now, is that you have an agent that's going to work on your behalf, because there's multiple companies out there and we deal with them all. And in the past, Plan F for people over 65 was always the best on a Medigap plan to go with. Well, now there's a Plan G. Well, I'm saving on here anywhere from $600 up to $1,200 a year. Like my mother was $1,200 a year. I pay the premium. I also pay her medical expenses. I changed her to a Plan G. Her only out-of-pocket difference between the two plans was $186 a year. But I saved $1,200. So to me, that's almost like a no-brainer. So when somebody has their birthday month, no medical questions, I can change their Medicare plan one to another, and if they want to change so they're healthy, I can do it anytime. Life insurance. Look up those old term policies, you guys. Someone took out many years ago. You find out when they're expiring. Have me compare them for you. You know, take care of your family. Don't wait until later on. Thank you, Dave. Don't wait until later on the life insurance when you get things happen uninsurable. Now, hey, I've been talking about that for years, but guess who has a life term policy that's about to run out? Me. Well, I've had some medical things over here the last couple of years. You know, even though I'm a real healthy guy, I hike and I dance, ballroom dancing, and I get my butt kicked in karate. You know, just things happen. You know, I had some stints put in on here. Well, for me to go get a new life policy is expensive. But what I've done is, some companies you can take the term policies if you're uninsurable, and you can turn them into a permanent policy. And the permanent policy is no rate up. It's a guaranteed issue. So make sure I'll go over the benefits with you. If I can save you money, I can save your clients money, make sure you call Dan, because I am insurance.
You know, the other day, Dan mentioned this Plan F to G and the savings, and I went with my plan with Dan, a year or so ago, because he told me what he put his mother on. I figured, if that's what the dude's putting his mom on, that's who I want. So he mentioned that the other day, and I contacted him, and I said, I want to save that money. I'll tell you what, guys, if you're not doing your insurance with Dan, why not? Thank you, Dan.
Quick question, the dates you mentioned, November to December 15th, that's individuals only.
Correct.
Right, so
Correct.
businesses, what's the rules for businesses?
Well, on businesses is that whatever your open enrollment date is, I can enroll a business that, matter of fact, I have groups of 2,000 or groups of 2 or 100 or 50. And that can be any month during the year. We can start a group plan. And also we can change from one group to another anytime during the year. That was a good question. Thank you. Okay, Sarah.
Well, part of my new client interview is Dan. Seriously, I mean, I have to, part of the tax work that we do now includes health insurance. And so if they do not have health insurance, I give them Dan's name and phone number, and I encourage them to call him. So thank you, Dan, for making the practice so much better.
Well, 2 weeks ago I called Dan and I said, gee, Dan, my insurance is high. He said, Plan G is for you. And he put me on it and saved me $500 a year.
There you go.
Nice.